Hello and welcome to Psyched for Sanity. I am one of your hosts, Dr. Brindle Doss. I am a clinical psychologist that specializes in, I almost said attachment.
That's because it's
You're
on your
in my
brain.
brain.
I'm infiltrating.
I don't specialize in attachment.
No.
I specialize in geriatric psychology, the treatment of trauma, and psychological assessment. Wow.
Correct. That's correct.
Is that correct?
Yes.
Thank you for...
minus.
A
A few
Fair.
docked because you messed up.
I messed up.
Yeah. I am Dr. Tara McKelvey-Parker. I am a clinical psychologist. I specialize in treating and assessing attachment wounds and complex trauma.
That is correct.
Thank you. A plus?
Yes.
Thank you.
I know you're that overachiever that wants that A+.
Yeah, I do. I do.
Yeah, you do.
Sorry, I'm not. Hashtag sorry, not sorry?
No, we don't do that anymore.
Oh, okay.
Nope.
Oh, God, how old am I?
A millennial.
Anyway, please say something. Go.
Just anything? Do you want me? This is my fun fact?
Really fun. Yes, that was my segue to you.
That was a weird segue. Please say something. Okay. Well, my fun fact, but you can't make fun of me too much for it.
Well, I'm feeling really self-conscious, so I might. I'm just going to be honest.
I still have a baby tooth.
Yeah, that's really weird.
You know what's even weirder?
What?
I have a younger sibling. I have a sister. And she had to have it pulled because it cracked. We are not twins at all. She had the exact same baby tooth in the exact same location.
How does that happen?
So there was no adult tooth underneath it.
Oh my gosh.
So it had to be genetic. Isn't that bizarre?
Well, what percentage of the population is that?
I have not Googled that.
You should, because it kind
Rudy?
of puts you up there with
Google it.
You know, like circus, you know?
Hey, first of all,
Just
don't insert.
set up
Listen,
a booth.
you can do a lot. You can smear my character, but don't insult circus people.
Okay.
We don't want to alienate any of our viewers.
I don't have anything against circus people, actually.
I love circus people.
I just think that you are on that level and you could have a booth there. So
oh my God,
no
really?
Implied.
Wow. So you complimented me.
It's a little.
That's unlike
it's a little
you.
freakish, I think, is what I was.
I don't know if it's circus level, just having one baby tooth.
It's interesting. I would love to know the science behind that.
I don't know the science behind it.
Okay, well, if you're going to tell a fun fact and there will be follow-up questions, then you need to have more detail.
Again, A-, I will B+, whatever. I will come back with more data about my baby tooth. So where did we leave off in our last conversation to make sure we're keeping our viewers
So we
with us?
left off talking about secure
Right.
attachment and what that is and what it means for a securely attached person. And then we talked about the two insecure types.
Right.
Which is dismissive or anxious avoidant is another term, and the preoccupied anxious ambivalent is
Right.
another term for that type. So technically these types are considered organized types because
There's a structure to them.
there's a structure, exactly. So when they are experiencing a negative emotion or there's something going on in their relationship, dismissive person every single time is going to deactivate. So that means they're going to minimize their emotional experiences and they're going to want space.
Yep.
Every single time. Okay. A preoccupied person, every single time they feel a feeling or there's a relationship issue, they're going to get overwhelmed by their emotions and they're going to seek out someone else to make them feel better in some kind of capacity.
Someone else soothe me.
Yeah. So it's an organized pattern. With the last category of attachment, it's called disorganized.
Okay.
Another term is fearful avoidant.
Okay.
And these folks, they sort of run the spectrum.
Let's start in childhood. I think that'd be a good way to kind of help people understand what does this look like from a parenting style and in towards a kid.
Well, so someone with a disorganized attachment style generally has a parent or a caregiver or primary attachment figure who, it's oftentimes them, that is scary. That's really scary or unpredictable.
Okay.
Okay, and so these people experience like a childhood of chronic stress, essentially, in some kind of capacity. So they are usually quite scared and hypervigilant.
Okay.
And dissociated. I'll go into more detail about
we're going to define dissociated in a moment. That's an important term we're going to come back to.
And there's a lot of different kinds of dissociation.
Right.
But someone who's disorganized, when I say they run the attachment gamut, what I mean is they are avoidant, and they are preoccupied, and they are traumatized.
Yeesh.
So when they are experiencing an emotion or there is a problem in their relationship, they have no clear strategy to manage their feelings or to get their needs met.
So even the other attachment styles, their strategy might not be the most healthiest, but they have a clear goal.
But at least it's organized.
It has a function.
It's consistent essentially, and it usually works in some way.
Right.
Someone who's disorganized, they may ramp up their distress in some kind of way, like a preoccupied would, to sort of elicit support, and then push that person away and withdraw and isolate and say, get away, I can't trust you, or you're going to reject me.
Right.
And so there's a push-pull dynamic in that relationship, and there's a confusion around their behavior because sometimes they seem like they're more anxious, ambivalent, but sometimes they seem like they're more avoidant. So they just kind of throw crap at the wall to see what works.
See what's going to stick. Yeah, it's almost like they're mirroring the lack of predictability they experienced in childhood.
Yeah. Yes, because usually then their caregivers are also disorganized, or they're also fearful avoidant.
Right.
So they're unpredictable because sometimes they're dismissive, sometimes they're preoccupied, and sometimes they're scary.
Yeah.
Okay.
That's hard.
So people who are disorganized, it's really it's a fearful avoidant. It's really challenging attachment style. So again, like they will vacillate from dismissive and avoidant to preoccupied and anxious. And then when their trauma is triggered, then they dissociate. They sort of engage in some trauma-driven behaviors.
Right. This is a good place, I think, to pause.
Yeah.
Can you define, at a basic level, what dissociation is for our folks listening and watching at home?
So there's two kinds of dissociation, though, and it's sort of the different kinds are sort of classified as different trauma responses.
Okay.
So classic right brain dissociation is, I think, what most people think of when they think of dissociation.
Okay.
It is when you sort of, and it sort of swings in severity. So it can start mild to sort of autopilot.
Right.
We all kind of dissociate sometimes and go on autopilot.
You're driving home and you don't remember all the stops.
Right.
The turns you took home, but you know you did it, and
right.
you know you're safe and paying attention.
Correct. And then you get a little bit more severe, and that looks like daydreaming. It looks like zoning out. It looks like glazing over.
And that can last seconds or
hours. I mean, if you've
minutes.
ever stared at a wall for 3 hours and been like, WTF? That's
right.
a really clear indicator
or
that
you were talking to someone and you have no functional
memory
of what they were telling you.
So, and this is when trauma symptoms can start to look like ADHD symptoms, but this is a function when we're dissociated. It means we're scared and overwhelmed, and our body is trying to protect us from that feeling.
Right.
So some people dissociate in this way a lot, and then really severe dissociation is when you feel like you literally are not attached to your body. You feel like you're watching yourself like a movie. You can really feel like you're not present at all. So there's a spectrum of severity, and in trauma terms, that would be a freeze response.
Gotcha.
So for people who have unresolved trauma, as everyone who's disorganized or fearful avoidant does, one of the patterns is freezing. And other forms of freezing are chronic depression, right? Where we just feel like we are not living or really present. We're just sort of frozen. It's actually, for people who rely on this defense, usually the other ones have failed.
Right.
And they collapse.
Until this last one.
Collapse into freeze.
Right.
So when you're living a lot of time like this, it's really sad. It's really super.
It's hard.
Yeah. Yeah.
Okay. So now that we have another
freeze, and dissociation kind of fits in there, but there's also a left brain dissociation.
Okay.
This is actually way more common, and it falls into the flight category, which is another trauma response. So some people, the way that they've learned to cope with their unresolved trauma is to flee. And one way that people flee is to stay in their left brain.
Okay.
So
what does that look like?
So it is overanalyzing, ruminating, obsessing, over-logicking, planning. We're always in our left logical brain. It's always going, always going, always going. It's a flight from our body. It's a product of fear. It's just going, going, going. And then sometimes that translates into perpetual busyness, compulsions. We cannot relax our body or stay still. Other means of flight are drug use.
Alcohol. Any kind of disconnective substance.
It's a flight. Love and sex addiction, eating disorders. These are actually flight from our body and our feelings, and usually some really painful emotional experiences.
And those behaviors and those substances unfortunately reinforce those negative neural networks and those pathways that reinforce the disorganized attachment style and the disassociation.
Generally speaking, any kind of coping mechanism that you are engaging in that is trauma-driven is actually self-sabotage and will make everything worse. It is
spoiler alert, and also so important for people to know.
Yes.
Yeah.
Ultimately, people who are traumatized have toxic shame. They feel like they are not good enough. They are bad. They are not lovable. And so they have learned to cope with all of this in ways that actually punish them perpetually.
Right. Self-flagellation.
Exactly. Because they genuinely don't love themselves. They were not loved growing up. They were abused or severely neglected and not protected.
Right.
Or had really inconsistent, scary parents. So, yeah, there's that left brain dissociation I think is actually way more common for folks.
I get that a lot. I think I get a lot of folks that come in that are really having trouble focusing and having trouble concentrating. And they say, oh, I feel anxious, but it's the focus and attention.
Right. Well, when you really think about ADHD, trouble focusing, there's ADHD, but then if you think about what the person is how they're struggling to focus, it actually tells you a lot about diagnostically what's going on. If someone's telling me that they can't focus because they're in their brain thinking about everything they sucked at when they were little or everything they have to do tomorrow, that ain't ADHD. Right? Correct. That is anxiety, that is depression, that is this left brain dissociation. They cannot be present in the moment to take in information.
Right.
If someone is like classically dissociated and zoned out, they also are not going to be able to focus, but that's not ADHD as is, historically defined.
Historically defined and diagnostically defined as well.
Diagnostically defined.
Absolutely. So, okay.
Then there's fight and fawn.
Ooh.
The other two trauma responses.
Yeah. How do those fit into disorganized attachment?
So someone who's disorganized, again, they sort of like have a mountain of healing to do. It can feel like that anyway. And I have this attachment style, so I can sort of personally speak to it. They've got all the things that an avoidant person needs to heal. And they've got all the things that the preoccupied needs to heal. And then they have these trauma-driven responses and patterns that need to heal. And the pattern that you adopt, usually people have one or two trauma-driven responses that are more common for them, is based on their caregivers.
Yeah.
They inherit these
how they cope
defenses from their caregivers. So if their caregivers were angry and volatile, they may be a fighter, more likely, or like me, my mom was angry and volatile. I just sublimated the crap out of all of my anger and just was like a major fawner.
Yeah.
So fawn is a newer category of trauma-driven response.
Okay.
Basically what it is like you take care of other people at the expense of yourself. You legitimately become your caregiver's caregiver. Role reversal falls into this category. Right. My mom was very, very, very ill, and I was always taking care of her.
Right.
Emotionally, also like logistically.
Logistically, physically.
So these people often have a hard time knowing themselves because everything is really about caretaking other people. These are the people pleasers on steroids.
Yeah, it's like if you're so focused on having to care for the person that's supposed to care for you, you have no even time to check in with your body.
100%.
No time to check in with like your own emotions.
Yes, you don't know yourself.
Or even your own thoughts.
Exactly.
Like you're a foreigner to yourself.
Exactly. So hard time setting boundaries, hard time being assertive. That's the fawn sort of category.
Okay.
And then there's fight, and that is, what you would expect. Usually people who go into fight mode when they are threatened, when their trauma is flooding, they get really aggressive, they get really angry, they ramp up. But another, like, lesser known way of doing this is actually to control. That controlling other people
Is a fight response.
is actually a fight response.
Good to
It's
know.
a passive aggressive way to communicate anger.
Yeah, because I think certain avenues with certain places, anger is not only just prohibited how it's expressed in certain ways.
Yes.
But it's frowned on the minimal. It's frowned upon, and so
Yes.
how you another way to sublimate that would be to passively aggressively control the dynamic of the situation.
Exactly. Another one is, I mean, whenever people, like, just ignore you or stop responding to you or, like, perpetually late. These are all, like, subtle sort of ways of manipulating and controlling behavior. It can be a trauma response. So
yeah,
I'm the oldest of 4, and we all grew up in the same home and all have different trauma-driven response patterns, which is one of the reasons, the main reason why I got interested in psychology, just in terms of family stuff.
Yeah.
That's so fascinating. Like, how did that
happen? People are weird, man.
Yeah.
Fascinating, powerful, important, and complex.
Complex, yeah. So disorganized, those are the main pieces, right? So, like, someone who's fearful, avoidant as an adult, they're pretty unpredictable. They feel really unsafe, hypervigilant, just toxic shame.
Yeah.
But they can live doing these trauma-driven responses for their entire lives and not know that they experienced trauma.
Right.
You know, you could be dissociated for decades.
And
you
people
could be literally on a hamster wheel in your career and life for decades. Yeah,
I've worked in the past as a student. I remember a lot of times with military sexual violence and trauma. Those folks, a lot of the times it's interesting. Not all women, but some women seem to have a sudden awareness of their trauma after they become parents.
Yes,
that's a huge period when suddenly memories and or awarenesses or even events sometimes within the family.
That's what happened to me for sure.
Can 100% be triggered after you become a parent.
That's generally what happens then. If you're disorganized or fearful of avoidant, you have this trauma that is in your body. These memories, a lot of times you can't even remember what happened to you. It's just your body remembers what it was like to be neglected and abused and overwhelmed and scared. And when you have a baby, it's one of the scariest, most life-changing things ever.
It's also for a woman or a person that gives birth, I should say, a birth giver. It's dangerous.
It's dangerous.
It's
and
physically
it's like
dangerous.
Something in your body. Like, I had a whole thing about that.
I had a massive thing about that.
Yes.
I'll tell you that right now.
And so
it's
for
an alien.
trauma survivors, that is a thing.
Yeah.
And so it's all kinds of triggering. And so yes, my flight OCD, I think I had postpartum OCD, honestly. I mean, I was so terrified.
Yeah.
I just was so rigid about sleep. Like, I was very, very flooded. And since then, I've been on a journey of sort of being opened up and learning about my trauma and my, all the stuff. Because before that, I don't really think I was awake. I was like, just like putting one foot in front of the, like,
you were sleepwalking. You describe it as sleepwalking.
Before you wake up to your trauma, it feels like you're sleepwalking almost. Like, it feels like a dream. It's so bizarre.
Yeah, and I think in talking about attachment styles and trauma, it's important to note that, like, it's definitely a journey. It doesn't have to last forever. I think a lot of people don't want to do trauma work because they feel like it's going to take forever.
I'd say a solid year to really start to feel better, and that's been my case.
I think it would depend on the trauma and the length of time. There's a lot of factors and variables.
I'm referring to complex PTSD.
Absolutely, for complex.
We'll have an episode about the difference between PTSD and complex PTSD.
We absolutely, because that's not only is it a very strong area of interest for you, but also for me as well.
Yes.
And something that we both feel passionate about.
Yes.
Advocating for safety, consent, and communication.
Yes, definitely.
Well, I know this was a heavier topic today, but it was so important to really understand these different types of disorganization within attachment. And I think before I ask you what you're going to take away from today, I want to talk to the folks that are listening and watching. Sometimes when you listen to a podcast and you're getting information that's new or different to you, it can be really overwhelming and stimulating. I don't want, and I don't think you would ever send anyone the message that there's no hope for you. And even though hard and bad things may have happened to you, there is always hope. Even after really challenging and difficult decisions you may have made, there is always a path and a way forward. I believe that, and I have worked with people. I've worked with people in federal prisons who've done some really challenging things, and they have found a path and a plan forward. So I just want to make sure before I ask you what you're going to take away from today.
I was going to say the same thing.
Oh,
I was going to say the same thing because
twinsies.
I was starting to feel a little doom and gloom at the end of that.
Yeah.
It's really
it's
hard.
important.
It's heavy.
Information.
It's important information.
But it's also important to say.
But also, like, again, you can earn a secure attachment.
Right.
And that's the kind of work that I do with people.
Yes, you do.
I'm attachment focused, and my goal is to help my patients earn a secure attachment through understanding themselves, through understanding their defenses, through building a safe relationship. And you can do that with a therapist. 2 years is what the science says. 2 years of a safe therapy relationship, you can start to really build security.
You can feel differently than you feel now.
Yeah, and I'm walking that. I'm doing
Amen.
that right
Absolutely
now.
you are.
And I feel so much better than I did a year and a half ago. A lot better. So there's 100% hope and a path forward.
Right. Well, it's not hopeless.
No.
No, not at all. I think the last thing I'll kind of end today with, is I want to let them all, the viewer, the listener also know, just about my belief system. This is outside of a religious context, real quickly. I have this belief system that is really important to my work. Assessment, therapy, it doesn't matter. I believe that all human people matter. I think the moment you were born, you had value and worth that was intrinsic to your personhood, and nothing you have done or has been done to you has ever lessened, demeaned, or devalued that worth and value. It is set and stated. And I really hope, if you're struggling, you find someone to talk to if you don't believe like I do. This podcast is intended for informational and educational purposes only and is not a substitute for therapy, diagnosis, or any kind of professional mental health treatment. We hope that we can share with you our experience authentically and genuinely, and we hope that occasionally we'll make you laugh. Maybe you can relate to our quest and how we're psyched for sanity. The content we share is our personal opinions and insights. They are not clinical insights to anyone, and they don't represent or reflect any entity that we work and or have worked for in the past. But if listening to this podcast has made you think, we really encourage you to seek out a mental health professional in your area.